two of the ones from the rural setting said 50% of the women coming in labor have had no ultrasound, and at that point, no ultrasound training capability. And the other one said 50 to 75% of the women coming in labor had no ultrasound, and she also had no ultrasound capability. So I think the initiation of this project was working with those rural midwives and seeing there's just desperate need for basic ultrasound. And it's in that context that we coined this concept of the Big Five. Just basic information on what was probably a full-term woman. So needing to know how many babies, what's the position of the baby, where's the placenta, how much amniotic fluid, and do you got a heartbeat. And with just that basic information, better help these rural midwives triage patient management. So critical decision is, do you need to send the patient into the capital city, which from one of the sites is a good 3-hour drive on a bad road. The other sites maybe more like a 2-hour drive, and half of it's on paved roads. But that's a tough decision when you've got under-resourced environment and the cost of that transport and the risk of the transport to get a woman to a more capable facility like Cockaville Obstetric Hospital, where we are. Hello everybody, Aaron Schmidt here with Hardcore. Here's the team. Here we are at the Humanitarian and Rabia and Khadija. You can see a pile of stuff, which is a Mindray DP50 laptop ultrasound with 2 probes, and we've got 3 of the Mindray TE Airs handheld ultrasounds. We're excited. We're going to be training 6 folks today, so I believe it's going to be 4 midwives and 2 obstetric doctors, and we'll be based out of Cockaville Hospital here in Lome.
So we are on our way to Cockaville Hospital. So we're here in Cockaville. This is our setup for the ultrasound training.
Here in Lome, we have a volunteer who's about 8 months pregnant at Surgical Hospital, and that's the Mindray DP50 we donated. It's got a curved probe, which you can see there, and a transvaginal probe. We've got volunteer pregnant patients, so they're not real patients with any kind of symptoms, that are graciously offering themselves as our volunteers to practice scanning on. And we got 5 students, they're all midwives. None have had any ultrasound experience, so we're doing initial training. And we're about an hour into things and still just kind of doing the basics. What does black mean on the screen, and orientation of the probe. And soon we'll break out and get another ultrasound working so we can start getting hands-on time for our students to actually do the scan. So we're calling it the Big Five. So for initial assessment, we need to know the amniotic fluid volume, the number of fetuses, position of the fetus, location of the placenta, and fetal heartbeat. 3 of the midwives with one of our handheld, the Mindray TE Air. The translating, and Rabia's our sonologist helping them learn. We're doing real basic stuff like how much hand pressure, how to orient the probe for transverse versus longitudinal, and how to orient to the baby. The volunteer is probably 30-ish weeks pregnant. And initial training is just about orientation of the probe, how much hand pressure to have on the patient, and how to achieve angulation of the probe while orienting to, let's say, the baby that's moving, because the babies move on their own, but the baby's also moving with the mom's breathing motion. So that initial, just can you even keep the probe on target, is a lot of the learning skill.